Today represents the 9th month of my post-op bunionectomy. I had it on December 18th, 2015, and today is September 18th, 2016. This first picture is the day of the surgery. You can see all the markings from what the surgeon was going to take off from my foot, on my toe. You can see I didn't have a severe one. I had a moderate. This was day 14. And this was day 4. I apologize. That's day 4. And this is day 10. Interestingly enough, on the side of the toe, you can see I have another bunion there. I did not realize that until after my surgery. That is called a tailor's bunion, and it is hurting me. I'm not doing it anytime soon. It's just on the little pinky toe, and from what I understand, that type of surgery requires about the same amount of rehab and rest time as the one that's on the great toe. Okay, so this is what the toe looks like today. It is 9 months. The scar that was down here is actually faded. Has actually really faded, and it is not raised anymore that it had been for the previous months and stuff. So, what was the surgery and the rehab? What has that been like in these 9 months? I've experienced knee pain due to what my physical therapist said was this wonderful boot. The boot is actually protective enough, but it also has a heel. And it's also raised up. So in other words, I was not wearing on the other foot, another shoe that matched its height, so I became hobbled. So in other words, I was hip-hopping along, and it caused a lot of discomfort in the knee, and it took a while for that to straighten out. I went for about 40 sessions of rehab, and I found that I was going 3 times a week. For the first was like 20 or 25 sessions, and I had to cut it back. I was able to get another through my insurance company, another bunch of sessions, and that I changed to once a week instead of 3 times a week because it was just too much pain and what have you. And one of the things that I did take away from the therapy was purchasing this Thera-Band Flex Bar. So what you do with that is you take it and you are rolling it on your toe. So the essence is you want to get flexibility in the toe. 9 months later, I really still am having some sort of difficulty trying to do any sort of running. I am in good physical shape. I do work out 4 times a week. I have a trainer, so that's not the issue. Was I in shape? Yes, I was in shape. And I do believe that also was one of the factors of my healing rather quickly. Now, I'm going to also show the bending of the toe. Now, because I just did a little bit with the Flexi Bar, so it's a little bit loose, but it still experiences tightness. So I have to just go back and push it back. And I hold it for a few seconds, and I have to pull it forward. That actually helps to actually loosen it up. And I do this for a few minutes just before I go to bed. Now, if you notice, I cannot bring up that toe to meet with the other toes. I still can't. Sorry. It still does not match up. It's okay, but it still does not match up. So I can't do things like a plank on that toe. I have to turn slightly to the other toes. Whereas the other foot, of course, it's meeting up, and this is not meeting up. Now, in terms of it being a straight toe, no. I was not blessed to have it that way. And I thought in another video when I posted that I might have to go back into this. No, the bone is straight, not the toe. And that is the most important factor. I'm okay with it. At the beginning, I was not, and my surgeon had to really calm me down. Like, well, I thought my toe was going to be straight. And some people are blessed with it going where the toe is straight like that. I am not. My bone is straight. I'm okay with it. I'm okay. Now, this is the one that was from 1990. You can see it's a 26-year-old scar. it's well healed and flexibility is no issue. It goes far back, comes up, whereas this one is not still going as far back nor coming up. So this is the one I find to be the most difficult one. Another thing, nerve regrowth. I have not really heard anybody talk about that. Once you have the surgery, obviously when you're having the surgery, they're cutting into the nerve. That is like shooting pain a few weeks afterwards. My foot, I found, would start jumping as the nerves were regrowing back into, were searching its proper place within the toe and what have you. So that was just, oh my God, there would be some days I just would want to just scream for bloody murder and what have you. So that took about 6 months, and I'm now 9th month in. 6 months before the foot really stopped all the jumping back and forth. Overall, I'm happy I did it. I'm not looking forward to going and having this little baby cut off. Disappointing. I really wish I would have done them both at the same time, because the pain that I'm experiencing is when I walk, it's underneath, and that's the little puppy that hurts. But overall, I'm glad I did it, and that's my update. And 9 months in, yep, feel good. I can get into shoes. It's summertime now. It's fall now, so it's going to be interesting to see what it's like to get back into regular boots and stuff. No, I do not plan on wearing very pointy-toed shoes or cowboy boots or anything of that nature. For me, it's just not worth doing. For vanity's sake, I just don't want to do that. I really don't want to do that. Good luck to those who are going to do it, or those who have done it. Good luck to us all. Bye.